Everyone, welcome back to our channel. Today we will discuss about the most important topic, oxytocin. What is the definition of the oxytocin? Oxytocin is the peptide hormone produced by the hypothalamus and secreted by the posterior pituitary gland. It's secreted in the posterior pituitary gland, not an anterior. It is posterior pituitary gland. It plays a key role in the uterine contraction during labor and milk ejection during the lactation. Not milk, its help in the milk ejection, not in the milk producing. So next, what are the sources of the oxytocin? Hypothalamus, specifically the supraoptic and the paraventricular nuclei, secreted by the posterior gland, posterior pituitary gland. And mechanism, what is the mechanism of action? Oxytocin acts on the smooth muscle of the uterus and mammary glands. Uterus, it increase the intracellular calcium and stronger the uterine contraction. Breast stimulates the myoepithelial cell around the alveoli and its help in the milk ejection reflexes. Feedback mechanism, positive, its work in the positive feedback mechanism, stretching of the cervix or nipple stimulation, hypothalamus, then posterior pituitary, its growth in the posterior pituitary, and more oxytocin, stronger the contraction or milk let down reflexes. Physiological effects in the uterus, initiates and maintains labor contraction, facilitates cervical dilation, then reduces the postpartum hemorrhage by contracting the uterus. Breast stimulates milk ejection, let down reflexes during the breastfeeding. Other effects may influence maternal behavior and social bonding. Clinical uses, induction of labor, used in cases of delayed labor or the postpartum pregnancy. Augmentation of labor, strengthens weak uterine contraction. Prevention and management of postpartum hemorrhage (PPH), administer after the delivery to contract the uterus. Administer after the delivery to contract the uterus, not before the delivery. Before the delivery also we use the oxytocin for the contraction. Milk ejection, occasionally used in breastfeeding difficulties. Routes of administration, what are the routes? Intravenous IV for induction or augmentation of the labor, intramuscular for postpartum hemorrhage, and subcutaneous rarely used for the lactation purpose. Nursing consideration, assessments, maternal vital signs, BP, heart rate, we have to assess first. Fetal heart rate, monitor for the fetal distress. Contraction pattern, frequency or the duration intensity, we have to check first. Monitoring, overstimulation of the uterus, uterine rupture risks, water intoxication rare due to antidiuretic effects, sign of hypersensitivity, allergic reaction. Patient education, inform the mother about the effects, contraction, milk let down, explain the importance of monitoring, and contraindication. Cephalopelvic disproportion, unfavorable fetal position, previous uterine surgery, risks of the rupture, placenta previa or the vasa previa. Side effects, what are the side effects? Maternal side effects like nausea, vomiting, headache, hypotension or the hypertension, uterine hyperstimulation. Fetal distress, tachycardia, bradycardia. Meconium stained amniotic fluid. Key points for the exam. Oxytocin, the hormone of love and the labor, uterine contraction plus milk ejection. Positive feedback loop, service or nipple stimulation, oxytocin release, stronger contraction, milk letdown, main nursing priority. Monitor mother and fetus for the safety. Thank you everyone. Please like, share and subscribe our channel. If you are liking our content, please help us and give support.